Hello, everybody. The people speaking in English in our school. A good Saturday for everybody. This is a little webinar, talking about rehabilitation. It's a very nice topic that normally we do not go deeply to the word rehabilitation. And today we will talk regarding the physical rehabilitation. That's for physiotherapists, osteopaths, and medical doctors also, who will deal with the physical rehabilitation. Let me share a little presentation. There, and then we will start to talk about the rehabilitation. Rehabilitation is a very nice word, but I will try to work deeply today to show you what is the meaning in M.P.R, International School. Go now to the presentation. That's my CV, a little CV for the people who do not understand, do know me, and this is a small part of my CV. Rehabilitation. We talk today regarding the craniofacial system and physical rehabilitation. If we want to obtain a good physical rehabilitation and a permanent rehabilitation, it is necessary to work with an integrated interdisciplinary protocol. There is another way. There is no way to, if you want to have a good physical rehabilitation, it is not possible to do it if we work isolated. And that is a very important thing we normally teach in our school. How to work together all medical sciences with the physical rehabilitation. That's a very important point of view. Don't forget it, people who are dealing with physical rehabilitation. Integrated interdisciplinary protocol, that's the goal, to work with the team who speak the same language in diagnosis and therapy. M.P.R is this, myofunctional postural rehabilitation. That's it, the name of M.P.R. We're talking today about the craniofacial dysfunction, how to affect the physical rehabilitation, the treatment, and the prevention. That's a very important topic because if we understand that our rehabilitation normally, they have relapses. There is something for what, but we never ask why the rehabilitation is coming back. And that is a very important thing. And one of the topic is the topic we are talking today, the interferences that can affect the physical rehabilitation with the craniomandibular dysfunction. And why I am talking about craniomandibular dysfunction, because it's not just TMJs, it's craniomandibular dysfunction. That is the name, craniomandibular dysfunction. We go ahead. Craniofacial dysfunction and rehabilitation. The word rehabilitation is a very important word. It means re-enable a system to function as before. Very important. Very, very important. Don't forget ever that. When we are talking about rehabilitation, we are talking to rehabilitate or re-enable a system as a body is, as was working before. That's very, very important. In the organism, this means what? That we have to act treating the whole systems, not just doing a technique. That is why we cannot ignore the craniofacial system as an integral unit of our organism. Craniofacial system is a unit. A craniofacial system is connected with the rest of the body. It is not just teeth or T&Js. It's the cranial, we call that craniomandibular and cervical and postural system. When we're talking about that, we are talking about a good and permanent rehabilitation, not just T&Js. This dysfunction, when we are talking about the craniomandibular dysfunction, when we are talking about craniomandibular dysfunction, we are talking that this system, when it is not working well, it will affect the whole body, generating obviously hyper or hypoactivity in the muscle chains. For this reason, the balance of the system is very, very important. If we want to have a good functionality in the whole body, sometimes we see relapses in our therapies, and we do not understand why we have that relapses. Many years ago, I want to tell you some nice something that happened many years ago. Many years ago, I was invited to talk in front of a big community of people, implantologists, people who are doing implantological treatment. That means local treatment. And I was starting the meeting. I was thinking how to start the meeting. And I was thinking for many times, for 1 hour, 2 hours, thinking before I start the meeting, how I can introduce the webinar. And in my mind was arriving a flash. And I asked a question to the people. Was 100 persons working there in front of me. And I said to all of them, the people who never have a failure in their treatment, please put the hand up. And the whole people look around, look around one with the other. Nobody put the hand up. And I will say, always we have failures if we work. The point of view is we never ask ourselves why is the failure. We change technique. In any field of the medical science, I am talking in all medical sciences, we don't ask the question why is the failure. And one of the most important things that we have failures in physical rehabilitation is because craniofacial system is not working well. It is in a big dysfunction. And that is affecting the rest of the body. Think about that, please. Think about that because it's a very important question we have to ask ourselves. When we're talking about postural balance of our body, this postural balance depends on many things. It's not only one, but the craniofacial system dysfunction is one of the most important because it is a great disturbance in the posture and as a consequence in the physical rehabilitation. A good balance of the muscle change and the physios, the osteopaths, the people who are doing physical rehabilitation, they work every single day with muscle change. A good balance of muscle change is an excellent indicator of the body's health. And that's very important. We never forgot. Never have to forget. When we have muscle change in balance is a good indicator of body or physical body health. And craniofacial system is affecting this muscle change. If we don't take care on it, we will never have good physical rehabilitation and never we will have good health in our body. That's very important concept. When is the craniofacial system working well? When we have a good mandibular posture. Well, look at that. It's very simple. If we have a mandibular posture in a good position with a good occlusion, a good teeth occlusion, who maintain it, we have a good balance. But normally, a high percent of our population suffer of craniomandibular dysfunction who is affecting the general muscle balance. Remember, how does the TMJs affect the posture? Changing the position of the jaw. When the jaw is changing the position, our balance in the whole body is disturbing. And we can have different changes of the position. We can have changes in the lateral deviation. We can have forward position, retro position, different alterations that will affect the posture in different ways. I will try shortly to inform all of you how it's affected. Look at this, lateral deviation, forward position, retro position. When we changing this position, when we changing this position, we will affect one of the most important systems of the posture, oculomotor system, the oculomotor system. And when we'll affect the oculomotor system, we will affect the rest of the body. And this is the things how we affect it, how we change the position. Look, lateral deviation will affect the mobility, the convergence of one of the A's. Look at that. This is the test. When we have bilateral changes of the position, we will have bilateral hypoconvergence. This is the test. And how it will affect the posture. Look at that. We have lateral deviation, one eye is affected, overloading in our posture. We have, left. Another eye is affected, lateral overload of the posture. And when we have the forward position, we have hypobilateral convergence, and then we will affect not the side position of our body, but the very center, forward or back. The mandibular position, when we have a changing in the position of our jaw, we will start a defense which is a bruxism, who create hyperactivity and obviously chronically will create a chronic postural alteration. How we can do a rehabilitation if we don't treat it? How? How we imagine that we can have a good rehabilitation if we do not annihilate this situation? We never will have a permanent rehabilitation. That's very important, you will understand. Bruxism is a defense to protect the TMJs, but it's creating this changing, is increasing depression, alarm, bruxism, and then slowly will affect the rest of the body. That is why and how. Bruxism it is not a stress. It's a defense for the system, who is a very bad defense. Bruxism is creating chronically injuries, chronic pain, and postural alteration. A common misconception is bruxism is caused by stress. No, the stress is not causing, it's not a cause of bruxism. This is the phone. Bruxism obviously chronically is creating postural pathology and stress. Bruxism cause stress. The changes of the position like this, the most dangerous situation in our body is the retroposition. It's affecting the whole muscles and chronically, slowly, is creating for the rest of the body adaptation with adaptive scoliosis. Those are the symptoms, the common symptoms, or the main symptoms about the craniofacial dysfunction is headaches, dizziness, loss of the balance, noises in the ear, cervical pain, diffuse muscle pain, tiredness when walking up, difficulty in sleeping, tingling in the hands, lumbar pain, mandibular click, and deviation of the jaw when it's open and closed. Common symptoms of craniofacial dysfunction. And how we can treat it? Obviously, we can treat it annulating the system. If we have a device who annulate the system, who is under dysfunction, the physical rehabilitation will be very good and permanent. We call that deprogramming the jaw when the craniofacial system is under dysfunction. The main objective is deprogramming the mouse. And we use the body equilibrium device, but body equilibrium device, it is not a bite, a common bite. It's a special thermoplastic device with a medical silicone, who is for all medical sciences. All medical science can apply the bed device to annulate the craniofacial dysfunction. And that eliminates the main aggression for the rest of the body. The bed is adapted, obviously. You can have a training to do that. It's adapting and annulating the most big disturber of the posture, who is the craniofacial system. And that device can be readapted anytime you do a physio rehabilitation or physical rehabilitation. And that is made with a special medical device, medical silicone, who under 37 degrees of the body is making readaptation, and that is the fantastic thing. We use that only mainly for sleep. We use a lot that during the sports. We have more performance in the sportives, and anytime you have stress or long trips, this is a very, very, very easy device for every medical science. Look at that. Patient with mouse problem, and look at how it's changing. The same here and the same here. The prevention of these problems, we can do that in this age when the child have a problem. To do not arrive then like this. This is not the same patient, different patients with the same pathology. In this age, you can prevent it. In this age, you can treat it. The prevention is very, very important. When we start very early doing a good specialty who is craniofacial orthopedic, craniofacial, myofunctional orthopedics. In that age, we can guide the growth and we can avoid the problem in the future. This device is the myofunctional postural regulator that act in the developed age. Look at that lady. Is the child. Very early we start with a very big dysfunction, with a very big problem in the posture, and slowly, we act with the craniofacial system guiding the growth and stimulating the growth. And slowly, we change the child. If you see, this is the same child. During the growth, we modulate the body and the craniofacial system. Look at that. Arriving to a good functional occlusion. Good functional occlusion who maintain the posture we obtain. And look at that, how she start, how it's finished. No more torsion, good body balance wave, and look at this, from this to this. We will start the course, a very, very cheap course. If you want to understand how to use the bed device, it's an online course. You have there the information of the course. And if you want to do that, is start 2 sessions, 11th of April and 25th of April. That will be a totally online course. And if you want to do that, this is the mail where you have to go with the and I will see you in the next transmission in English. Be good, have a nice we can and pay attention in our transmission in our channel, and you will be with us at all time. Okay, take care and see